So look, before I do that, can I start off by saying that I want to thank Jen Howard, the local member for Ipswich, who was urging me to come out here. And we've got some really good news today. So we have 0 community cases. This is unbelievable. This is great effort from everyone in Queensland doing the right thing. We do have 3 cases in hotel quarantine, but we're not worried about those. In the past 24 hours, Queenslanders have heard that message about coming forward and getting tested. We've had 12,829 people who've come out and had tests done. And yesterday, Queensland Health did 22,351 vaccines, which is excellent. So now we have 67.76% of eligible Queenslanders had their first dose, and we've got 48.89 who are fully vaccinated. So that's excellent. So today I want to talk about increasing our vaccination rates across the state. So what we do know is we want to get as many people vaccinated as possible. And can I thank Queenslanders coming up to me, telling me that they've been vaccinated, sending me their photos of getting vaccinated. And it's great to be here in Ipswich, where I can see families that are coming out and getting vaccinated. We have walk-ins, so there is no excuse. So currently in Ipswich, the vaccination rates are increasing, which is good. So 63.6% have had their first dose and 43.7% have had both. But in Brisbane, we are now getting over the 70% of people having had their first dose, and I really want to see a big increase, especially in Ipswich, Logan and Beaudesert, and the Sunshine Coast. Now, immediately after this press conference today, the Health Minister and Dr Young will be going into Central Queensland, Mackay and Rockhampton to urge those communities to increase their vaccination rates, and I thank them for doing that. We need this to be a big Queensland effort, and like I said, the Delta strain will come here into Queensland. We need to get our vaccination rates up as high as possible before we have those outbreaks here. So come on, Queensland, let's do the right thing. Let's go out there and let's get our vaccination rates up as high as possible. Now, here at Ipswich, they're doing 1,000 doses a day. They can get up to 1,500 doses. So if you're living in Ipswich, of course you can go to your local GP, or you can go to your pharmacies, and I know that there's even a pharmacy next to this hub here that's doing a lot of Moderna. I think they're booked out for the next week or so. But there is no excuse that you can't come in here and get your vaccine. So if you're in Ipswich and you're watching this press conference, I really need you to come out and get vaccinated. We went down to Logan where our vaccination rates were low. Now they've come up a bit as well, so that's good to see as well. So please do the right thing. The other thing I wanted to remind people is with your check-in app, you can now go onto that check-in app and it says get your vaccine, and it will tell you where the closest place is for you to get your vaccine. So that's another way, or you can book online. That's another way that the government is trying to assist you, but the Health Minister will talk to you more about that. So I'll hand over to Dr Young.
Thank you, Premier. So good morning. It's lovely to be here in Ipswich and to see this fantastic facility that was made by the team at the HHS out of nothing. So they've really created a first-class facility, and there is plenty of capacity. So it's really important that everyone who lives in this area comes forward and gets vaccinated as soon as possible. You have got one of the best public health units in the state who has done a really, really good job managing the virus till now, but eventually, and it possibly won't be long, we will see Delta variant come in and it won't be able to be controlled. The only control will be the number of people who are vaccinated. We know that the vaccine is very effective, very safe. So please, if you've already had one dose, make sure you get your second dose at 3 weeks, 4 weeks or 12 weeks, depending which vaccine was your first dose. And if you haven't had a first dose, please come forward today. I can't think that there's anything more important than getting vaccinated as soon as possible. There is lots and lots of capacity. So come forward, get vaccinated. That will protect you and your family and the community. Thank you.
Well, it's great to be here at Ipswich. They've put through more than 40,000 vaccinations already. They have a lot of capacity for walk-ins here. They're open 7 days a week, 8 till 4, and Tuesdays and Thursdays open till 7 p.m. So as you've heard, there is no reason to not be coming out and getting vaccinated, whether it's a GP, community pharmacies, or the Queensland Health Community Vaccination Hubs that are all walk-ins across the state now. As the Premier said, the check-in app has now been upgraded, so please update your app. And when you update your app, what you'll find is there's a new link that says get your vaccine. You'll be able to click on that link and you'll be able to find where you can get a vaccine. You'll be able to register to get a vaccine at a Queensland Health site. It'll also tell you where you can walk in. It'll tell you where you can find a local pharmacy or a GP. So it's never been easier to get a vaccination. And we know that it is absolutely critical that you start getting your first vaccine now, because it's going to be at least 5 weeks till you have that full protection. And we can't wait 5 weeks till we see whether there's an outbreak happening in our community again. Now, it's always a great day where we can stand up and say 0 community acquired cases, but we also know that it's just on our border. We know that we're getting more people travelling from Victoria and New South Wales coming up who are positive. And of course we have overseas arrivals in hotel quarantine, as we have had today, that are still bringing the virus into the country. So please, don't wait, come get vaccinated. This is an amazing vaccination centre at Ipswich. No matter where you live in Queensland, there is a vaccination centre or a pharmacy or a GP near you where you can come and get the vaccine for free, and there are multiple options of vaccines available. So please, don't wait, download your app, find out where your closest vaccination centre is, come out today and get vaccinated.
Thank you, Premier. Yesterday we saw 14,517 vehicles intercepted at our road borders, 123 were turned around, and one person was issued with an on-the-spot fine at Goondiwindi for attempting to breach the border. Of the 339 persons processed at our domestic airport, 11 were turned around and 80 placed into quarantine. We're still having to hand out masks, so the reminder is there for all those areas impacted by mask restrictions, and there are a variety across the state, of course, depending on what area you're in. You are required to carry them and wear them, so 77 handed out, as I said, and one person at Roma Street Railway issued with a fine for not complying with that direction. Also, for persons in home quarantine, whilst we're seeing very high levels of compliance with that, a reminder to all that we will continually check compliance against people in home quarantine. Yesterday, unfortunately, at Highvale, we saw a woman refuse on multiple times to comply with directions to comply with the home quarantine requirements, then was directed into hotel quarantine, refused to go, and was arrested and taken to the Sandgate Watch House, where she was bailed and placed into hotel quarantine in the city. So there are consequences for that sort of behaviour, and please comply with that. Thank you.
Thank you, Premier. Thank you, Premier, and Dr. Young and the whole team for coming out to Ipswich today. I'm delighted to see you here. I think you've become one of the most trusted teams over the last few years. Your presence brings a lot of comfort to people and a lot of reassurance. But I'm really grateful for our Health and Hospital Service for pulling together this hub. It is a hive of activity all the time, and that makes me very happy. At the end of the day, Queensland Health is one of the biggest employers in Ipswich, so just about all of us know somebody. We have a loved one or a friend who works for Queensland Health, and it's our frontline health workers that will really be feeling the brunt once the Delta variant and once COVID comes into Ipswich. So, get vaccinated, protect everyone in our community. Thank you.
Thank you, Premier. Councillor Marnie Dorr and myself give the Premier and also the Health Minister and the Chief Health Officer the warmest welcome to Ipswich. Thank you so much for coming along. We've been quite fortunate in Ipswich. Our we haven't had any community transmission. However, with the new variants, with Delta and so on, we know that's only a matter of time. Our vaccination rates are lower than the state average, so I really appreciate the Premier coming and the whole team here, and from Queensland Health and in particular Westmoreland Health, for coming out here to really boost to get people to come out to Ipswich to get vaccinated. So we're quite delighted. Council has been providing this vaccination hub free of charge to Westmoreland Health. We're working side by side with Westmoreland Health to increase those vaccination rates. So thank you very much, Premier, for coming out. And thank you, Lance and Therese and Jen, for organising it as well.
Thank you. Thank you. We're happy to take a few questions.
Premier, there's reports this morning the English cricket teams coming out here will be quarantining in Brisbane 14 days and allowed to play cricket matches. Do you think all Queenslanders who need to come home will be brought home by the time the English cricket team gets here?
I'm not aware the COVID safe plan's been finalised yet, so I don't think that's correct.
What are the arrangements though?
No, there needs to be a COVID safe plan that hasn't been signed off yet. Okay.
Four of the major
Yes.
hospitals in North Queensland are on code yellow. Have you had any luck with the Prime Minister talking about that funding arrangement?
The letter has gone to from all the health ministers to Greg Hunt. Can I just say here, this is a time when we're dealing with a global pandemic and a national pandemic that we all need to work together. So I know people like to sensationalise things, but now is the time to actually work together. I'm up for that, and I think this is what Queenslanders want and Australians want. They want their state government and their federal governments to be working collaboratively together in their best interests. Like I said, there is a huge surge that they're seeing in Victoria, that they're seeing in New South Wales, because they haven't, especially in New South Wales, they haven't had to deal with a virus outbreak like Delta before. This is what's coming right across the country. That is why we are putting a lot of effort into preparing our hospitals, and now is the time for greater cooperation between the Commonwealth and the states. And that's exactly what the health ministers have done by writing that letter.
Emergency physicians have warned the state's health system is already at breaking point. What's going to happen if that funding doesn't come in before Delta starts to circulate?
I just think we need cooperation. We look forward to hearing the response from Greg Hunt, but this is a concern not just shared by the health ministers, but also the AMA. So I'm happy for Yvette to elaborate on that. But if there are any other questions for me?
Are you concerned that 4 hospitals are on COVID?
I think you're seeing great pressures across a lot of hospitals across the nation. This is not a unique problem to Queensland. This is happening, nearly every other Premier raises this as well at National Cabinet. This is an issue of national concern.
So you're not concerned though that 4 hospitals are at code yellow in North Queensland and we still haven't seen the worst in South yet?
This is pressures that are happening on hospitals across the nation.
You're the Queensland Premier.
Yeah, of course I'm concerned. Of course I'm concerned. Yes, I am. Don't mix these messages up, please. These are pressures that are being experiencing across the nation, and with Delta, you add further pressures. So that is why we are working very proactively with all of our hospitals and health services, but you also have to take into account what the AMA is saying as well.
What else are you doing though to specifically address the issue?
Yeah, the health minister can address all that. We've got extra money going in. But as I said, these are issues that are happening across the nation. Now, apparently, we had some figures out the other day that when you have the Delta variant in some hospitals in New South Wales, it's an hour wait to get I think the Treasurer actually mentioned those figures. It's an hour wait to get an ambulance.
They're seeing their surges already because they've got Delta. We're seeing the increased demand. Even
this was happening in hospitals in other states like this even before they had those outbreaks. No, it is. I'll get the health minister to elaborate. She's been talking to all the health ministers on a regular basis. Now, are there any other questions?
Just about the Sunrise State. What's happening with the rebranding of the Sunrise State and how much is that going to cost?
You can ask the Treasurer. He mentioned it in a press conference about the Sunrise State. I'd like to see Queensland the Olympic state.
What else are you waiting on from the Doherty Institute in terms of work?
Yep, we are waiting on further work on the Doherty Institute. And as I've said, when that work is finalised, it would be great for that to be publicly released so the public can see it all as well as the state leaders. No, it's not, because the Prime Minister said it's coming back to National Cabinet in a couple of weeks.
Why vaccination rates so low in these areas? Is it hesitancy? Because we know that the Chief Health Officer says
It's not incredibly low, but what we'd like to see, I think what you've seen is, because we've had some outbreaks in Brisbane, you've actually seen people coming forward to get their vaccination. So that's why it's quite interesting that those rates are higher in those areas, and we have been proactively targeting areas that are lower to bring them up. So what we've seen in the last month is increase of vaccination across the state, but we are concerned that we should see a bit of a higher rate here in Ipswich. We want to see more in Logan Bow Desert. I'd like to see more on the Gold Coast, Mackay and Central Queensland, and then up in our Cape communities, our remote Indigenous communities, we need to make sure that we're increasing the vaccination rates up there as well. So I want to see all of those rates uniform across the state. That would give me greater comfort when, of course, when we would have further outbreaks of Delta.
Do you think that vaccination rates would rise if the government had a plan?
We've got a plan. We've got a national plan. We've got a national plan, and that national plan, we're in phase A, and we are following phase A. Then, of course, the federal government has to plan the booster shots. So then we've got to get everyone vaccinated, then we've got to get everyone a booster shot as well. Then we need a plan for the children that I've said very publicly about, and it's great to see that the federal minister has acknowledged that. And then, of course, there is the hospital capacity issues, which are being dealt with at a national level as well. Realising that the hospitals will be under extreme pressure when the Delta outbreak happens.
That national plan, though, is for reopening at 80%, which you said yesterday not necessarily is going to happen.
No, we've got a target of making sure that we have 80% double dose vaccinated. But what I said yesterday, and what I will continue to say, what we have seen in the ACT is they've been able to get 93%. To protect Queenslanders, I would like to see as many Queenslanders as possible vaccinated, which would reduce our risks if and when we get those outbreaks.
But going back to that national plan, though, you said you're obviously happy to deviate from the national plan if you think it's in Queensland's best interests.
I will always keep Queenslanders safe.
We're not necessarily working to that national plan, are we? So
no, that's not correct. No, don't put words in my mouth. That's not exactly what I'm saying. No, I said very clearly, we're in stage A of the national plan. We are following that national plan. Part of that national plan is booster shots. So ask the Prime Minister the plan for the booster shots, because that's in the plan as well. So, don't just cherry pick parts of the national plan when you're not cherry picking other parts of the national plan.
The theme park operators, though, they say they'll need at least a month.
Yep.
Reopen so they can actually ramp up their businesses. And
Yep.
I'm sure there are a lot of
Yep. The best thing Queenslanders can do is get vaccinated. This is the best thing. Until we get the population as vaccinated as possible, we will be exposed. So the best thing I want for Queenslanders is to get vaccinated. This is the central issue, everyone. The central issue is the vaccination. So I am urging Queenslanders and Queensland families to come forward and get vaccinated to protect yourself, to protect your family, and to protect your community. Now I'm going to hand over to Yvette. Are you right? No, they're still on the health issues.
So there's one thing every single eligible Queenslander can do to help prepare us to ensure that our health system is not overrun by COVID as we move forward. That is to get vaccinated. That is the absolute key. So if you're not concerned about your own health and safety in getting the vaccination, do it for our health workers. Do it for our doctors, our nurses, our cleaners, our wards people, our security, everyone who goes to work every single day in a hospital to look after you and your loved ones, put their lives at risk. And we have seen from New South Wales that there have people who have gone into hospitals in New South Wales without the virus, have contracted it within the hospital and has died as a consequence. We want to do everything possible to avoid that. We have our staff vaccinated, but you as patients, as visitors who walk into our hospitals, those of you who will come in with COVID, there is one thing you can do to prepare this state and to prepare our health system, and that is to get vaccinated. Now, on the broader issue of the health system, every single state and territory is under pressure. You only need to do a 5-second Google search, you'll see South Australia, Western Australia, stories right across the country of ramping, of pressures on the system. This has been going on for some time. The demand on our health systems has been going year on year on year. Now that's why we have said to the Commonwealth that the original agreement with the states and territories was to get to a 50-50 national reform agreement. Now the Commonwealth stopped at 45% and they have not moved since. We're saying that 45% should be brought up to 50, which was the agreement almost a decade ago, and we're also saying that the guarantee that we got to give us the funding means that if we have to suspend elective surgery or whatever we do because of lockdowns and COVID cases, that we will still be funded per activity and we won't have that reduced. So that was the agreement we got part of COVID, a national agreement that says you will still get up to that maximum cap even if you don't engage in all of that activity. We're just asking for that guarantee to continue. It ceased in June. We need it to continue because there is still fluctuations in our hospital system. There's still suspension of surgeries whenever we have to go to lockdown or we have to restrict operations in the system.
If you're fully vaccinated, will you automatically have to go to hospital in the future? Or what's
Look, we've got to work through all of that, but the more of the population that's vaccinated, the more that we can get on with living our lives normally again. We will learn to live with COVID, but what we don't want is the pandemic of the unvaccinated. We don't want communities that have lower rates than the rest of the state and the country becoming infectious hotspots. That is what is at risk. When we talk about 80%, well, if we have 90% in some areas of Queensland and 60% in other areas of Queensland, what's going to happen to those communities at 60%? They will get the virus running through their communities. We can't risk that. Our Indigenous communities. So we want to see every single person who's eligible take it up. As far as code yellows, New South Wales has had code black, the worst case scenarios playing out in their hospitals. We get code yellows for a whole range of reasons. We have, from day one, not denied that we have had demand and significant pressures on our health system. Our health workers are stretched over running our hospitals that is seeing significant increase in ambulance calls out and ED presentations, as well as running testing and running vaccination, and also managing hotel quarantine. We're still doing this after 19 months. So our health workforce have done an incredible job. There's one thing you as a Queenslander can do to support those health workers, and that is go and get vaccinated.
When you have those code yellows going around North Queensland, often patients from Mount Isa will go to Townsville. If the ambulance is being diverted in Mount Isa, there's not a lot of places they can go. What's happening there to free up that capacity or elective procedures?
Well, what a code yellow means is that it alerts the whole of that HHS to look at changing different practices within the hospital to immediately take pressures off certain areas. These are decisions that are made locally by local hospitals and hospital and health services based on the demand. Now, sometimes these code yellows can last an hour, sometimes they can last a day or longer. It all depends on what the situation is. But when I was in Hervey Bay the other day, the ambulance service at one station said to me that the day before they'd had a 30% increase in Code 1 calls out. 30% increase in one day. No matter how well your health system works, you can't have those sorts of beds just sitting there empty, automatically planning for a 30% increase in a single day. So we're working through these. But I've seen reports interstate that some health services are using taxis instead of ambulances to transport people. So to report that this is a Queensland problem and Queensland alone is completely false And that is why every single health minister across the country, every state, every territory, of every political persuasion, has signed 3 letters now to the Commonwealth saying we need your support, because there's a whole lot of things that impact on the public health system that is the responsibility of the Commonwealth that we as a state cannot control.
How satisfied are you though with how the government is ramping?
Our staff are working tirelessly to deal with these pressures. There's a whole lot of initiatives that are being put in place. I'm seeing improvements in areas. We are working with those areas that are still seeing those really, really high demands and high ramping, but we have seen some improvements in areas. We've got different initiatives being put in with our co-responder, with our TINs, which is our nurses who help triage those who are coming off the ambulances. We have an extra $163 million going into purchasing beds both in the public system and the private system. But that's my point. When the private system fails, when private hospitals are closing, when private hospitals even don't have bed capacity, then it doesn't matter how much money you put in the system, the capacity constraints are there. And that's why the Commonwealth needs to work with every state and territory. We all need to work collaboratively to look at the health system now and going forward as to how we deal with the new norm as COVID moves into our communities.
You mentioned before about ramping, the demand across all states and ramping across all states, but without a COVID outbreak in the states, which states have seen worse ramping in Queensland?
Which states have seen the worst?
Which states have seen worse ramping in Queensland?
I've seen, as I say, I've seen some pretty shocking numbers of wait times, of taxis being used instead of ambulances.
When there's no COVID outbreak, is there we're talking
Well,
about
what's the point of saying if we're not talking about COVID? We are living with COVID. Let's not deal with hypotheticals of if we didn't have COVID. Well, I'm not going back.
Other states throughout the last 18 months, we've had a lot less load in our hospital system.
Oh, that's not true. That's absolutely not true. Absolutely not true. Go talk to Western Australia. Go talk to South Australia. Go talk to Tasmania. Go talk to the ACT. Go talk to Northern Territory, who have not had big outbreaks of COVID, and ask how their health system is travelling. If they weren't having a problem, do you think every health minister would have put their signature on a letter to the Commonwealth? Do you really think that they would have all come together and said, we need urgent action to help us if they didn't have pressures? Of course they have pressures. Well, that's a question for Scott Morrison. There's an election coming. It's that simple. There is absolutely no reason when you have every single state and territory's health minister's signature on 3 letters, why are you only talking about one state?
Are you looking at easing any of the restrictions, given we have only had 0 today, we had 2 yesterday?
Well, the restrictions we have obviously is on visiting hospitals and aged care, disability and correctional services, and also the mask wearing and the density. We said that would be 2 weeks. We'll take the advice of Dr. Young. If Dr. Young thinks we can ease that earlier, and then we'll take that advice. But we did say we would look at 2 weeks from when we saw those original cases. Thank you, everyone.
Now, guys.